When the rabies virus reaches the brain, its detrimental effects become pronounced. It spreads rapidly, causing the brain to swell. This interferes with normal brain function, causing a variety of symptoms, including significant neurological and behavioral changes. The first symptoms, such as fever, headache, and general weakness, can often resemble the flu. As the disease progresses, the infected may experience anxiety, confusion, agitation, and insomnia. There also may be unusually high levels of aggression, a symptom that sharply reflects the deteriorating state of the brain. One of the most terrible symptoms of rabies is paralysis, which usually begins at the site of the bite and gradually spreads to other parts of the body. Rabies can appear in two forms, furious and paralytic. Furious, the most common, is characterized by hyperactivity, impulsive behavior, and fear of water. In contrast, paralytic rabies is less dramatic but just as deadly, causing muscle weakness and eventually paralysis. Once the rabies virus has wreaked havoc in the brain, it begins to destroy the rest of the body. It travels from the central nervous system, reaching various organs and tissues. The salivary glands are mainly affected, which is a critical factor in the spread of the virus, as it allows the virus to be transmitted through bites. As the virus manipulates the body, it travels along the nerves to the salivary glands, which triggers hypersecretion of saliva, making it a primary source of transmission. It causes spasms in the esophagus, preventing swallowing of saliva, increasing the possibility of transmission through saliva exchange. The condition of the infected person worsens as the virus spreads. Symptoms such as nausea, vomiting, and abdominal pain may occur, as well as abnormal heartbeats or breathing problems. Victims may sometimes suffer from hyperactivity and hallucinations. Eventually, the person may fall into a coma. Death usually follows a few days after this, usually from respiratory failure. In animals, the rabies virus manipulates the behavior of the host to encourage its spread. Infected animals show increased symptoms of infection and perhaps show agitation and increased tendency to bite, which is how the virus is most often spread. One of the most common symptoms of infection, and perhaps one of the most misunderstood, is fear of water. It is not a psychological fear, but a physical reaction. In the infected, attempts to drink water or even the sight or sound of water can cause severe painful throat spasms because the virus's impacts on the esophagus. In this video posted to Reddit by Necroed of a video showing symptoms of hydrophobia, he is seen managing to take a sip of water. The poster says he is probably painfully, tortuously thirsty, but the rabies virus is concentrated in saliva, so it makes you unable to swallow. Even though the thought of water or drinking can cause painful muscle spasms in the throat as the disease progresses, so he wants the water, but when he goes to drink it, his throat closes, his muscles cramp,